Well, Dr. Fong, you mentioned, we talked a little bit about missing teeth and the havoc they can raise, jawbone missing, headaches because of the hinges here not correct, and of course more teeth falling out, even gum disease because of the teeth are missing, so the gum gets irritated somewhere on the line, and that is in itself not good. Now tell us, so those are all a really bad thing. So what options do we have, however, to replace such a tooth? In terms of technology and also in terms of financial, because I'm sure like the way we buy cars, maybe we all want a Rolls Royce, maybe we don't, but the point is there's a difference between, a very expensive Mercedes and a not so expensive Toyota, but at the same time, in many cases, both of them do the trick. So shed some light on this situation of options we have to replace our missing teeth.
Of course, I'll be delighted to. Let me tell you what I would recommend based on my experience and my knowledge and what I would want to have done in my own mouth. There are basically three different types of options as far as replacing teeth. The first and best option and most state-of-the-art method to replace missing teeth is to replace them with dental implants. The second option would be to replace it with what we call a bridge, as most of us know it as, or also known as a fixed partial denture. And the third option is to replace it with a denture called a removable partial denture or a complete upper denture or lower denture. So there are three ways of replacing those missing teeth. As far as expenses, or I should say investment in your teeth replacement care, the implants, dental implants, would be the most expensive. The least expensive would be the removable partial denture. But if you look at it from a long-term basis, even though the upfront investment for the dental implants may seem higher, in the long run, that's going to give you the best prognosis, the best longevity, and the best replacement that is most natural to your own teeth that you have in your mouth. When you compare that to, let's say, a fixed partial denture or the bridge or the removable partial denture, over time, those may require additional maintenance and or replacement of those partial dentures. So therefore, in my belief, and if it was to be done for my mouth, I would select the dental implants. But if finance is a concern, you have other options, such as the bridge or the removable partial denture. Those are adequate replacements.
Okay.
But you have to decide what works best for you.
Got it. So let's talk a little bit about what I think, and tell me if I'm wrong, what are probably the two most common replacements, which is a bridge, because it's fixed, because people don't want to have something movable in it. We all remember grandma with
right.
teeth coming in and out, and we somehow, it doesn't quite
yes.
jive. Do you understand? And you hear
yes.
people talking with dentures who, they might never fall out when they eat and laugh and whatever, but they feel a little wiggle wobbly. Like when you wear a shoe or pants, which feels like it's falling down,
yes.
it's just a little too loose. You run around throughout the day very uncomfortable, right? So,
right.
So let's talk about the bridge. The bridge. And let's assume we have one tooth missing.
Okay.
Not an all too common occurrence. So what you do with a bridge is you use the two teeth next to it to put a crown over it and hang a third tooth below in between, and that's kind of the bridge, right?
That's correct.
Right. So let's just for a minute talk in price only about that. Let me ask you, so when you take an implant because if you do, you need to do basically 3 crowns, and crowns aren't necessarily that inexpensive these days. So when you do an implant, which gets this titanium stick, right, you're using the same material than the hip guys use for hip replacement and stuff with an implant. Is that correct?
Right, it's a metal titanium anchor that is implanted into the jawbone.
Right, and
that serves as the post.
Right, is that one implant versus the 3 crowns? Because you only need 1 crown now, 1 ceramic, cup up there. Is it really that much expensive? More expensive if you have that situation, which is a very common situation?
No, it's not that much more expensive. Not at all. In fact, even though it's one tooth, though, you have to realize that there are two stages that are involved with it. One, it's the placement of the implant into the jawbone. That's the first phase. After it's had an opportunity for it to heal and to integrate with the jawbone, then the second phase can be started, and that is the fabrication and placement of the new ceramic crown to match your own natural adjacent teeth.
So let me ask you, is there any data out there? Because implants have been around 20, 30 years, but over the last years they have become a lot better to do the titanium and all kinds of stuff. But crowns are pretty good too and have done a job for a very, very long time, crowns and bridges. So let me ask you, what is the overall consent of when you do an implant, how long it more or less lasts, if there's such a data out there, because you might not do it long enough for them to actually break down, versus a crown, a bridge, how long it lasts. What is, obviously not this is what it is, but a good feeling number?
I'd say a good feeling number for dental implants is that the longevity of it is 20 plus years, as long as the patient is in good health. Now, compare that to a bridge, the longevity could be that long if someone does take good care of their teeth and maintain it. However, the likelihood of that is not there because of the fact that when it involves adjacent teeth, we do have to modify it and then place those crowns over it. And those areas where the crown fits over the tooth can possibly decay over time, especially if the person is not meticulous in taking good care of cleaning it. And so when there's bacteria that adheres to it, it could eventually break down those natural teeth. And then that can create larger problems for that bridge itself, which could require future replacement or possible loss of the teeth if the person doesn't come to their regular dental exams to make sure that everything is in good, healthy working order.
Right. And then obviously if you do a bridge, if that bridge fails, first there was only one tooth missing, but then you grind it down 2 teeth and put this on it, and if it then fails, you basically have all 3 teeth which are in need of major repair then. Is that true?
That's right.
Yeah.
That's true. Because 3 of them could now become compromised.
Right. And you mentioned something about, the cleaning. Now, while I guess you need to do good dental care, whether you have an implant, whether you have real teeth, or whether you have a bridge. But I think what you're referring to is when you have a bridge, those 3 or 4 teeth, they're kind of welded together. They're one piece, really. And you need to go under the teeth with one of those thread things. And if you're a slightly sloppy guy like me,
right,
you might just, my wife, oh no, she would do it. My wife and me go to the bathroom at night, same time. I finished shaving, flossing, brushing, showering, and she's still flossing. You see what I'm saying? So
yes,
she probably would be okay with it, maybe, or at least more likely compared to me. So when you then don't floss, now you get gum disease, and that in itself, no matter how good the bridge was in itself, it will basically rotten the whole thing from inside out. Is that basically what quite often happens?
That's right. If the bacteria there begins to rotten out the tooth or lead to decay, then you could lose those teeth. But you did also touch the fact that, if you have all that plaque and bacteria hiding in that area, it could also lead to gum disease. And gum disease, if it's allowed to continue without treatment, and it's a silent disease, many people don't realize they may have that gum disease, that could begin to deteriorate the gum tissue as well as the bone. And when you start losing bone, then those teeth become more mobile because they don't have something to anchor to, and then you could possibly lose that bridge to periodontal disease or gum disease. So yes, plaque, bacteria, gum inflammation, all those factors can lead to the early loss of teeth.
So basically, an implant does last a tremendous amount longer, and doesn't risk that adjacent teeth because of it start falling out too. Yet depends, on how many teeth you have to replace. There might be the matter of cost. And by the way, when you do an implant, does it preserve the bone and avoid this caved-in feeling more than a when there's no implants, but when you have a partial denture or for that much a bridge?
Yes, the dental implant would certainly help to preserve the bone and prevent it from atrophying. The reason why is because with the dental implanted into the jawbone, it creates some pressure to it, so it continues to stimulate the bone to stay present there. If you don't have the implant there and you're biting and there's no pressure on the bone, then the bone is telling the body, I don't need to be there. And so therefore it begins to just dissolve away. So it's like an astronaut in space, in zero gravity environment. If he doesn't exercise while he's up in space and he returns back to Earth where there is gravity, he gets a little wobbly because why? The bone is not used to that pressure, and so it doesn't continue to build and stay strong.
Right. I've experienced that when I was about, I think, 9 or 10 years old, and I broke my wrist, and then for about 6 weeks or whatever, I had a cast on it. When that cast came off, my hand was thin, and yes, it was weak. I barely could pick up whatever it is, bicycling, whatever kids do. You definitely noticed a weakness. It took a couple of weeks to come back and disappear, but it was there. All right. Good. So here
that's a great example, yes.
Yeah, so we do have many options. Finances do play a role, but if it's basically replacing one tooth versus a bridge, it doesn't even seem to be too big of a money difference. In almost everything else, when it is computer and whatever it is, we always try to buy the newest technology. We say, why would I want to take an outdated one when there's something better? So sometimes it's really a question, why do we even make those questions when it comes to health? Why don't we go for the very best out there, and I'm very happy to have it. But I do understand that there are those options, and any option is probably better than doing nothing. Am I correct there?
Absolutely.
Well, all right.
Make a decision.
Thank you very much, Dr. Fong. Bye-bye.
Bye-bye.